Okay. Very good day to everyone joining us for this Centre of Research Excellence on Achieving the Tobacco Endgame webinar. I'm Coral Gartner, I'm the Centre's Director, and before we commence, I would like to acknowledge the traditional custodians of the unceded lands that I'm joining you from. That's the Jagera and Turrbal peoples. And I pay my respects to their ancestors and descendants who continue cultural and spiritual connection to country. I also extend that respect to all Indigenous peoples joining us today. Today we'll hear from Veronica Martin-Gall, who is from the Tasmanian Department of Health and also the Menzies Institute for Medical Research. Veronica has worked in tobacco control licensing, compliance and policy at the Health Department for over a decade and holds a Bachelor and Master's degrees in public health and is also in her final stages of her PhD. Veronica is going to share some insights from her research on Tasmania's tobacco retailer licensing scheme, and I'm really looking forward to this presentation. If you have any questions while she's presenting, please just place them in the Q&A function, and hopefully we'll have plenty of time at the end that we can get to any of the questions that you put to Veronica. And so we'll deal with them at the end of the presentation. And now I'd like to hand over to Veronica to tell us all about tobacco licensing in Tasmania. Thank you.
Thanks, Coral. That's a lovely introduction. I'd like to start by acknowledging my supervisors, Kate McIntyre and Amanda Neal, and my primary supervisor, Dr. Shauna Gall, no relation. And I'd like to also acknowledge the traditional owners of the land in which I'm presenting, the Lutruwita, the Palawa people of Lutruwita, Tasmania, and I pay my respects to the traditional owners of the land in which we live, work, and I study. So, as Coral said, in 2015, I joined the Tasmanian Department of Health to manage the tobacco licensing scheme and compliance team with really limited responsibility for policy development. But when immersed with the tobacco retail licensing scheme, it was clear that there was an opportunity to further explore the register. It was longitudinal to inform tobacco policy. When I started this part-time PhD with Menzies, my research question was informed by some of the cross-sectional studies that I had been involved in, like this one, which found that there was twice as many tobacco outlets in the lowest socioeconomic areas in Tasmania, and that 79% greater tobacco retail density, that is retailers per 1,000 people, were found in more remote areas. And this prompted me to ask, is tobacco retail availability prompting the smoking, or do more smokers who purchase cigarettes encourage retailers to sell? And if restricted, would Tasmanians stop taking up the habit or quit? With that translational research question in mind, a lot of the outcomes from this research has been policy, and there's been some academic stuff, but also there's been some legislative recommendations as well. And I guess now that I'm nearing the end of the PhD, I guess there's some reflection on what we wouldn't have seen. And so when we were planning this, we could not foresee, for example, a COVID-19 pandemic in 2020, nor could we have foreseen the explosion that is vaping because it was a part-time PhD and started in 2018. So I think that the landscape has changed quite significantly since the beginning of this PhD. And another research piece of work that I had was a very small scale study with qualitative research of ex-tobacco retailers who said that fees and low profits and enforcement hassle, the tobacco control officers visiting them, were reasons to stop selling tobacco. And I guess that's where the idea of squeezing tobacco retail density actually came to us, because there was something to do with what we were doing as government that impacted on the decision and the number of retailers selling tobacco in Tasmania. I think some of those retailers stopped selling tobacco, about 9%, after being exposed to material that was about the negative impacts of on those businesses. But as a policy officer, I have to reiterate that tobacco use remains a deadly habit, and 15% of Tasmanians smoke regularly. It kills 2/3 of its users worldwide, as you would all know. And that means that in Tasmania, 550 lives on average are lost every year. And it's costing the Australian economy in social and health costs $37 billion every year. But there is international and national strategies that seek to restrict tobacco retailing. So the World Health Organization Framework Convention on Tobacco Control recommends licensing of retailers, and it also the national strategy. The national strategy also recommends or seeks to build on initiatives that measure and reduce availability by type, number, and density. And the Tasmanian tobacco retail, the Tasmanian plan also seeks to reduce retail availability. Sorry, I've just got something wrong with my controls there. Sorry. So there we go. There we go. We're back on track. So this figure describes governments historically have used demand side measures to reduce tobacco use. Strategies can be population-based, individual, demand or supply driven. So an example of the demand measures at an individual level could include smoking cessation services, or demand measures at a population level could be the tax on tobacco. Supply at the individual level may include a ban on sales to your child, and supply measures at a population level could include a ban on illicit tobacco because of packaging laws. But increasingly, that population-based approach to reduce smoking tobacco supply, like tobacco retail licensing and restriction, are being introduced internationally. So when I'm framing what stops retailers from selling tobacco, I think we need to reiterate that in the yellow, we have Tasmanian laws which regulate tobacco supply and demand more broadly. This is not, of course, an exhaustive list, but gives you an indicator. So the Tasmanian tobacco control laws from the Public Health Act are on the left, and that could include the licensing scheme, the register of sellers, the way that tobacco is sold, advertising and display bans on sales to children or smoke-free areas, and on the right, the Commonwealth laws, currently under the Public Health, Tobacco and Other Products Act 2023, which introduced bans on tobacco products and restricted packaging. Or we could look to the Customs and Excise Act, which applies tobacco tax. So as a policy officer and researcher, my broad research questions were, what does a mature tobacco licensing register look like across Australia? How does Tasmania's compare to other states? And is there a suitable mechanism for suppressing tobacco retail density? How does tobacco retail density change over time as a descriptive study? Is it possible to do a trend analysis of observations from a tobacco licensing register in Tasmania 2000 and 2019? And what is the latest research telling us about the association between tobacco retail availability and smoking prevalence? What is best practice internationally? Finally, on this little island state, is there an association with the observed tobacco availability and smoking in the period from our local data? So the first study that we have is to kind of look at that register. So Australia and the ACT were the first states to introduce tobacco licensing in 2000, and by 2025-26, we'll have all the Australian jurisdictions operating or establishing a licensing scheme to manage supply of tobacco. To describe that licensing scheme, we felt it was important because there are a few published examples of the operation and impact of this tobacco control legislation, and there's no nationally consistent licensing framework since 2000, when the Commonwealth Government introduced a framework to enhance tobacco control. So I reviewed some websites, some strategies, and all the legislation online. So what does Tasmania's licensing system look like? Well, it's a positive licensing scheme, and like alcohol sales, you have to apply for a license before you start. You have to pay an annual fee, and today it's $13.70, which is pretty high. There is a legislation that ensures that a register is held by the Director of Public Health about each seller for compliance reasons, to take them to court or to take action. The original purpose was to oversee laws like sales to children, display and advertising, and the sale of only legal tobacco in those plain packaging packets. There are fines for non-compliance. In 2017, the scheme started to mature, I would say, and some more strengthening measures were taken on board. So police checks for licensees are a part of the licensing scheme. There was a mandate to make sure that licensing of e-cigarettes sellers was also put on that. And in 2021, reporting volume sales to estimate consumption was applied to the scheme. Moreover, the scheme enabled a voluntary surrender of vapes after the ban that was introduced by the Commonwealth Government in 2024. And finally, as mentioned before, the Tasmanian Tobacco Action Plan embeds the licensing and legislative action as part of a comprehensive tobacco control scheme. But there are certainly strengths, and then there are weaknesses of this scheme. The number and type of retail outlets have fallen over time, and historically, a very high compliance rate has been achieved in Tasmania. Between 2012 and 2024, there was a doubling in fines issued for sale without a license or sales with illicit tobacco products, so those that are not in plain packaging. And another limitation of this scheme is that penalties are relatively low compared to illicit sales and their profits. There are no closure business orders that are applied to tobacco businesses, although those powers are within the Act, and it does not include a ban on interstate or mail order sellers. But the government has created policy around this licensing scheme, for example, to increase capacity to enforce the laws, to use volume reports, to target smoking cessation and build on initiatives to reduce availability in low SES areas. And also, as mentioned earlier, quantitative, qualitative, and spatial studies have been employed using the register and the scheme to inform policy. So this table really shows just the level of national consistency across what we think might be useful to put a public health lens on tobacco licensing schemes: compliance, planning, monitoring, restricting across Australian jurisdictions. But why is this important? Because no state and territory publicly reports tobacco retail density, and nobody restricts tobacco retail by type, location, or number as per the national strategy. However, the South Australia and ACT do restrict online and mail order sales and sales from vending machines, as you can see in the red dotted lines. But a national consistent approach has a number of benefits for implementing and monitoring legal sales, which can detect and dissuade the sale of illicit tobacco, which undermines so many efforts to reduce smoking on a national and local level. The other benefits are sharing information, disrupting cross-border supply chains, robust investigations, and criminal charges or high penalties for tax evasion through the sale of illicit tobacco, which is a different part of the enforcement measures. Innovative models of geospatial retail restriction could actually be achieved based on store type or density. We could do modelling and implementation or evaluation within licensing schemes if everyone had one. And here's Tasmania. Yeah. So based on that investigation, what we found was that we have some modest recommendations around a nationally consistent law that gains compliance with really hefty penalties. That schemes would be helpful if we could better monitor legal sales across borders, which would then detect illicit sales. The scheme could allow for research to inform regulatory or other tobacco policy like cessation, where to target cessation through things like volume sales reporting, because we could estimate consumption and also where illicit tobacco is impacting on legal sales, as is the practice in the Northern Territory and Tasmania. And finally, a scheme that monitors plans to restrict tobacco retail availability could be the next steps in a mature licensing scheme. Thus, I'm now asking, based on this understanding or like a better understanding of how a maturation of a scheme could look like, could we use our Tasmanian scheme to observe retailers to see what happened over time? So this second study is currently under review with a journal, but the study is a repeat cross-sectional study, and in the aim was to really ask, how does tobacco retail density change over time in Tasmania, and how does government policy directly or indirectly influence this? It's longitudinal and descriptive, because I think it's really important to say before we go into this that we're not restricting tobacco retail density or licensing in Tasmania at this time. This is just simply what has happened because of attrition or any other unfavourable environments in which tobacco retailers are selling. The outcome measure was tobacco retailers per 1,000 people, and the exposure measures we looked at were tax laws and other measures that were applied in Tasmania, and all the prices were adjusted for Australian dollars in 2019. The analysis method that we used was a join point regression, which is a type of time series with limited points producing average percentage change. And this allows us to identify inflection points or changes in the trend across time. So this is a causal diagram. It really just shows the possible factors that are associated with retailers' decision to stop selling tobacco. First of all, what comes first, smoking or the tobacco seller? Of course, smoking prevalence is in this diagram as a possible confounding factor to influence the decision to sell tobacco. But so is insurance costs and socioeconomic status, consumer price index, illicit tobacco, were all considerations based on preliminary research that could impact on Tasmanian sellers choosing to have a license to sell tobacco. We also focused on tobacco laws that created an unfavourable market or selling environment. So in terms of exposure measures, this timeline presents key Australian government control measures in blue from 2000 onwards. The reforms began with graphic health warnings on cigarette packs from 2006, followed by a 25% tax rate hike in 2010. In 2012, plain packaging was introduced fully and advertising bans were extended to online advertising. In 2013 to 2016, tax rose again by 12.5% annually, and from 2017 to 2020, quarterly increases applied to loose tobacco as well as the sticks. In the centre is the cost to purchase a licence in Tasmania, and the Tasmanian laws are in yellow. Began in 2000 with the introduction of the regulatory scheme along with along with ACT, and the register and the tobacco control officers. Between 2006 to 2009, legislation addressed pack sizes and introduced smoke-free areas. And these bans were applied to, the display bans were applied to sellers, any seller, in 2010, and specialist tobacconists in 2012. And vending machine were also restricted to just behind the bar to service areas only in 2012. In 2017, e-cigarettes were regulated like tobacco, as I mentioned before, and with licensing, you can see that the fees went from $397 in 2016 to $1,172 in 2019. So that was a doubling and tripling in the following year. So as an outcome measure, I mentioned we were going to use tobacco retail outlets per 1,000 people, 2002 to 2019. This graph shows a line of retailers going from 3 retailers to 1.2 retailers per 1,000 people in Tasmania between 2002 and 2019. An average percentage change of a falling 5% was found across the period, but there were 5 segments and 3 periods of significant change in density. In 2002 to 2006, there was a 4.6% change. In 2009 to 2013, there was an almost 8% change. And in 2016 to 2019, there was an almost 9% per year change. So when we cross-reference the periods in which there was significant change in tobacco retail density, that 4%, that 8%, and that 9%, we can start to make some inferences, particularly around the retail environment that may be unfavourable for retailers to sell tobacco. In the blue, federal laws had a temporal association between reduced tobacco retail outlet density with import tax, plain packaging, and advertising bans. In the yellow, direct restrictions on vending machines and government license fees going from about $300 to $1,100 per premise reduced tobacco outlet density too. So based on these significant changes for tobacco retail density over time, as a policy officer, I must ask, what does the international evidence tell us about squeezing tobacco retail outlet density and its association with smoking prevalence in other parts of the world? What is best practice? So in some governments, retail restriction has been implemented. Here are some examples where policy approaches include by census tract in San Francisco, which is like an area where a certain number of people live. Density policies to limit tobacco in deprived areas, like in Philadelphia, and a ban on retail sales, as has been applied in Beverly Hills. I'm not sure how many people actually smoke in Beverly Hills, but even so. And which measures of tobacco availability could be the basis of our policies in Tasmania? For example, proximity, density, store type, mixtures of those measures. Previous reviews have omitted a lot of ecological studies or population level studies, which I think are the ones that we use surveys and we look at, geographical large areas, whereas individual studies are numerous. But as a policy officer, our laws are universal and monitoring of tobacco is done by prevalence studies. So I think they're important to include in our assessment of what we should apply in Tasmania. So then we did a systematic review and meta-analyses. The review was based on 5 online databases to January 2023. And I guess it was important to align our policy with this review. And so we used search terms of smoke, tobacco, retail, outlet, store, vendor, shop, governments, and variations of. We included an outcome measures of anything that was smoking behaviour, experimentation, relapse, cessation, initiation, and current or daily smoking. Our exposure measures were divided into tobacco retail density, which could be retailers per thousand as a defined area, or retailers per square kilometre. Proximity, which was like distance to or from an outlet or between the two, and home, school, or another community infrastructure. And mixed measures were those measures that weren't easily translated to each other. For example, retailers within 6 blocks, 5 minutes drive from home, or walking distance. We weren't really sure if that was 800 or 400 meters, especially in different environments. And we used a Joanna Briggs cohort cross-sectional study, amended evaluation to ensure the quality. We did a metadata analysis if there were 3 or more studies with the same population exposure and outcome, and we excluded vaping stores, smokeless tobacco, and advertising or modelling studies. So this is a Prisma diagram, which shows how many studies we actually looked at. From about 7,000 papers, we did a narrative review on 62, and we did a metadata analysis with 32 studies. There was significant heterogeneity, so differences in the kind of population studies and methods or measures that they used throughout, and a number of individual cohort studies. Many studies were about children and smoking behaviour, particularly near schools, and a smaller number of ecological studies came up. This is a table of the summary of the studies that occurred. So in pregnancy, we found 3 studies about retail availability and pregnancy. There were 25 studies about smoking with youth that covered proximity, density, and mixed exposures. And there were 18 studies about adult smoking behaviour, like relapse, cessation, and current smoking and density. Smoking during pregnancy is one of the findings of this narrative review, which is important for Tasmania, where we have particularly high numbers of women under 20 who smoke during their pregnancy. More retailers locally was associated with between a 10% to 37% increase in risk of smoking during pregnancy. 2 of the studies looked at trends in a neighbourhood where smoking had been declining, like ecological studies, and when a new store introduced, tobacco selling as a chain, there was like a halting of that decline in smoking during pregnancy. And one of the studies was a fixed effects longitudinal analysis using individual mothers as their own case controls in Scotland for 15 years. Availability, according to these studies, when tobacco availability increases, smoking changes. And in Tasmania, where there are no restrictions on who can sell tobacco, this is a real risk for us. Can you imagine if the reject shop, I'm not sure if you have those in all of our states, started to sell baby wipes and tobacco at discounted prices? That would be a disaster for us. This forest plot, which is a metadata analysis, provides a summary of the evidence of the effect of tobacco retail density on smoking behaviour in children. There were 25 youth studies in total, and then 5 and 4 either on current smoking or if the person has ever smoked cigarettes or tried cigarettes. There was higher retail density was associated with a child who had ever smoked cigarettes by about increased 20% odds, and current youth smoking, which has increased 23% odds of trying cigarettes. And tobacco retail density near schools, where there were so many studies, actually, when we did a meta-analysis, found that only a 3% increase in likelihood that someone would try tobacco. So we looked at adults as well, and this forest plot shows that among 6 studies, the overall effect of tobacco retail density on adult smoking where there were 20 studies in total, and then there were these 7 studies that we conducted a metadata analysis from. More retailers who sold tobacco per square kilometre or per 1,000 people was associated with greater chance of tobacco smoking in adults, which increased the odds of about 10%. There was less evidence to associate between tobacco proximity, so how close it was to someone's home, and relapse. I also think it's really interesting that there was quite a difference between the greater odds in young people than in adults, and I'm not really sure what that's about and probably warrants some further research. But it could be about the development of risk-taking behaviour in young people or their influence and susceptibility to marketing. So based on the systematic review, we found that tobacco retail density was associated more consistently with tobacco smoking in pregnancy, youth, adults, and a little cessation. We found that it was more consistent to refer to tobacco retail density as compared to proximity or those mixed measures. And we were aware from our previous study that tobacco retail density can be monitored and could be a mechanism, and the mechanism to do that could be those licensing schemes. Thus, based on the findings of the systematic review, the observational review of retailers, and our understanding of a licensing scheme, we thought, does tobacco retail density is associated with smoking in Tasmania with our local data? So why would we study this? Well, there's been limited studies in Australia with using actual data from a licensing scheme. There's a great study that I read from South Australia, which was cross-sectional and found that tobacco retailers were associated with rurality, socioeconomic status, but unrelated to smoking prevalence. And we had a similar study cross-sectionally that found in Tasmania, rurality and socioeconomic status was also associated with more retailers. In Western Australia and in Tasmania, we found that extra socioeconomic status was closely linked to smoking as well and the retailers. But in New Zealand and Queensland, there are modelling studies that show or model or establish that if we reduce retailers really strictly and squeeze them to like 10%, we could have real reductions in smoking, small but significant reductions. However, these models do not use the register longitudinally, so we felt like we could have a go at it. But to date, no study in Australia has examined a longitudinal plausibility of an association between tobacco licensing data as a proxy of the availability of tobacco and smoking behaviour. So we aim to explore if significant periods of change, as we investigated in a previous study, was associated with changes in smoking prevalence in Tasmania. We used an ecological study with the outcome measure being smoking prevalence from the Roy Morgan data. And our exposure measure was those tobacco retail density changes between 2002 to 2019 based on the second study I provided to you. The availability we used or the analysis that we used was interrupted time series analysis, which you would be more aware of in this audience. Commonly it's used with real life interventions, and it can kind of find a short-term or measurable impact on an outcome. In this case, the outcome was smoking prevalence. It can show a change in trend or a change in the slope of the impact. We also did correlation analyses. So this table really describes the study participants who were from the Roy Morgan survey, which were all Tasmanian, including telephone and online recruitment. There was about 50,000 interviews over the 20 years, and there were mainly over 24-year-olds. But yes, and you can see that about 4% of the contingents were underage smokers, 14 to 17-year-olds. The study results were weighted to the Australian population, and there's about 23% of the total survey participants which were that described themselves as smoking during the period that they were surveyed. There were slightly more women than men. So this figure provides a line of the tobacco retailers per 1,000 people, reminding you from the previous study, it went from 3 to 1.2 retailers per 1,000 in this period. It's really important to say that in 2000, the licensing scheme was started, but it took 2 years for all the retailers to be put onto the register. So we didn't see a full and complete number of retailers until 2002, which is when this analysis started. I'm sure that that's what some of the other states are experiencing right now. And you can see the red line in the picture is the percentage of smoking prevalence, and the standard error of about 2% is the shaded red area. And as mentioned in the last studies, we applied the breaks in this figure to look at what happened in relation to smoking when we had already investigated that tobacco retail density had declined significantly. So those dates were 2002 to 2006, which was a 4% fall, and we found 2009 to 2013 was about almost 8%. In 2016 to 2019, there was a 9% fall. We also found that there was a strong positive correlation between smoking and tobacco retail density. However, it's important to note that volume of tobacco is not measured here, just the number of outlets. Tobacco retail density, based on just this visualization, shows that it falls steadily from left to right. But smoking prevalence is more variable. It does fall in general, the trend going from about 28% down to 17% in the period, but it's more variable within those breaks or boxes. So before I run on to explain this next table, I think it's really important to say that interrupted time series analysis has to have data before and data afterwards. So we were limited to those breaks 2009, 2013, and 2016. This table shows that in these years, the break is known as the year, or the change or intervention, for lack of a better term. Before the change in tobacco retail density, in the year 2009, there were 25% smoking, and after the break, there was 20% smoking prevalence in this weighted sample. In 2013, there was a similar change in estimated smoking prevalence before and after the change. I think it went from 24 to 18%. And in the right-hand column, you can see there is no significant association with the break and smoking behaviour. Time is marginally associated with smoking prevalence, but the change in trend, which is that starred area, has no significant association between the retail change in availability of tobacco and smoking. I'm going to visualize this to help you understand just a little bit more. So the grey area depicts the time tobacco retail density changed in 2009 on the left and 2016 on the right. On the left, it was a almost 8% percentage change. The dots are the smoking prevalence per quarter. The blue line is the line of the estimated smoking prevalence just from survey data, and the red line is the counterfactual, as though smoking prevalence had no break. And as you can see, those two lines are too close together. There is no change in the grey area of the blue line that is significant or bigger than the variation between the dots, which is the estimated smoking prevalence. This means that there was no meaningful association between smoking prevalence and time on either sides of the graph in this picture. So there are strengths and limitations of this study. It's taken from a Tasmanian Government licensing scheme for almost 20 years, so it's real live data, it's mandated, it's a census. It's a longitudinal study where nowhere else in Australia has had a go at this, so that's a positive. Sorry, I'm just moving my keyboard. And this research aligns with 3 levels of national, local, and international policy to restrict retail availability. I think it's important to note, and I think I said it earlier, that illicit and vaping tobacco was not a part of the registered retail scheme and could certainly undermine this retail availability work. Over the last few years, it's certainly increased across Australia. The Royal Morgan data has released in 2025 some data that estimated that in 2020, there was only about 1 to 1.2% of all adult smoking that was estimated based on their surveys to be illicit tobacco or vapes. And that has increased to about 5% overall in 2025. But I think it's relevant in this context because we were using the same survey data, but also remembering that our data stopped in 2019. I think our ecological study design was useful. It had a stronger statistical power. However, it does mask the individual community experiences of people living in rural Tasmania. It's like studying, Hobart is like studying Wagga Wagga or Toowoomba. It's a regional centre and it's small, and lots of our people live in local places. So this may not represent a tobacco retail density across a state, may not represent the story of people who go shopping once a week in their local area. An alternative study design could capture this based on the literature review. There are lots of ways of doing that. And I think it's really important to reiterate that this is attrition of tobacco retail density, but not a restrictive policy. And it may be that there's a threshold of the number of retailers that starts to change whether or not people decide to smoke or people have an influence on their story in terms of tobacco smoking. In the future, we need to find out if public support tobacco retail restriction models and what do the retailers think. A more complex model or study design, like an auto-regression integrated averaging study that may attempt to estimate smoking through volume sales or mass media campaign exposure, or estimate better the illicit tobacco and vaping consumption, may be able to show some association that is statistically significant for retail availability and smoking. I think it's really important to note that the COVID-19 pandemic changed a number of similar behaviours in terms of purchasing, and that online and mail order purchasing may have an impact on whether or not retail availability has a part to play in a comprehensive tobacco control strategy. We've used a population level exposure, but individual cohort studies may reveal a different experience from some populations, like rural and remote Tasmanians. I think it's really important to say that we were looking at one retailer per 1,000 people across an average of Tasmania, but actually there are little islands where that's 4 to 1,000 people. So every Tasmanian has a different experience. And then I think that a larger sample may detect an association, and it could be that across nation, cross jurisdictional example may show some association. So my conclusion would really be that our results provide a roadmap, but more work is needed. That this is the first Australian study to use real-life longitudinal data and smoking prevalence, that in Australian, and to reduce smoking, we need to include monitoring smoking, cessation interventions, pharmaceutical support, mass media campaigns, all the traditional ways a multifaceted, comprehensive approach to reduce smoking is applied, ensuring equity to access and prevention and services to help quit. And finally, that we need to be monitoring other countries on the range of methods and impact that they're having on retail restriction, because state, national and international policy still advocates for restricting supply. So speaking of other countries, overseas, many countries have implemented different approaches to restrict retail availability. For example, in the Netherlands, a staged approach just simply to reduce incidental purchases has meant that there's significant reductions in the type and retail density of outlets, but it's mainly by type, and it was staged from 2003 to 2025. They're doing a 4-year evaluation at the moment in Maastricht University. In Hungary, the government has reduced the retail availability from 4 to under 1 retailer per 1,000 people, and that's quite interesting. It's showing some significant changes in initiation of smoking in young people, particularly over that 10-year period. And in Mauritius, where I volunteered to go and investigate personally, they have introduced proximity measures to reduce availability, particularly around infrastructure where kids learn and grow. And the evaluations of these designs may help to refine our tobacco retail policies because, of course, if policy runs ahead of research, evidence, and practice, it's possible that we could end up with a natural experiment or introduce restrictive laws. And in Tasmania, where national, state, and international policy supports restrictions on tobacco retail density, what could this look like? Well, it could be policy around density limits in deprived areas. It could be a tobacco commissioner, similar to a liquor and gaming commissioner, who could refuse a license based on a poor impact on a community. Who knows? But I think more research is needed. And that's me. I have my email address there if you'd like to contact me for more questions, but I think we've got some time, have we?
Yes, we've got a few minutes. We've got about 15 minutes to the hour. So thanks so much. That was a great talk. Did you want to turn your sharing off? I'll go to questions that we have. So John's asked a question regarding your very interesting time series of tobacco retail outlet density. It's difficult to decide the relative effect of national versus state measures. So would looking also at time series of other states be helpful here?
Absolutely. I think that's a great idea. I feel like we're just creating a roadmap because we had the data and we had a long line of data. I mean, I think that paper that we wrote around maturation of licensing schemes really advocates for everyone to be doing similar stuff so that we can compare and contrast. We're looking at 2% of the Australian population down in Tasmania. And so I would love to see it from another state's perspective. I also think that talking to retailers across the country might be the next step. So working together on that would be good as well. But yes, I feel like we're just providing a roadmap, John.
And I think that that's the challenge, right? The data, because you think about the three biggest states by population, Queensland, New South Wales, and Victoria, they haven't had tobacco retail licensing for very long. So that data that you've got from Tasmania just hasn't existed necessarily in the bigger states. So that's probably one of the challenges. But, moving forward, hopefully we'll have some better data around the country with that.
Yes.
Okay, I've got a question. So if you have more questions, people online, just please put it in the Q&A function. So the Northern Territory uses a tobacco license condition as their mechanism for banning the sale of flavoured tobacco products. And it occurs to me that, potentially a broad range of restrictions on tobacco retailing could be implemented through license conditions if the underpinning legislation for the licensing scheme supported that. I just thought I'd get your views on what you think about using that mechanism and whether that would be viable in Tasmania to do, various restrictions, so things like even minimum unit price or something like that.
Yeah, I think that license conditions are more complex in the way that I know that the legislation is written in Tasmania, because any condition can be what's that word? The Director of Public Health can be taken to court to question any condition because there's an appeals process associated with it. We went through that when we applied the condition to report volume of sales sold per month of June every year. And we were very careful to lay out its purpose, the reason we were doing it, how we were going to share it, because if one big company appeals a condition on your license, then it sends a precedent to the rest of them to not abide by that condition. So my suggestion would be that you could reduce that risk by putting it in primary legislation. And I feel like the rest of the Australian population, with only 15 or even less, 12% of the community smoking, and lots of people wanting young people to not take up the habit, I feel like public opinion would really support changes to primary legislation to prohibit the sale of, for example, the flavoured tobacco products, or even just any of those things like the closure measures that we've got in place. I think that the community and politicians particularly are behind us in our tobacco control efforts.
Excellent. Okay, I've got Tony Blakely's asked if he can be unmuted to ask a question. So will we let Tony talk?
Yeah.
Okay, let me find the button for that. Tony, where are you? So I'm just trying to find you in the list here where I can. Oh, you're able to do it yourself. Wow.
I think so. Can you hear me?
Yes.
Veronica, fantastic. This area is so under-researched. Second, I unfortunately could only join half an hour in, so I didn't catch your first part, but I think I heard enough to be able to say the following and ask you the following. My comments are that we've done a lot of this on retail outlet availability in New Zealand, and the evidence technical term is basically shite. We had to use distance to travel and put a cost on that. It's really, really difficult. And I just am staggered that nobody has done this type of work. So good on you for doing it. My questions are here, could you do even better with the data you've got? So, for example, and apologies if I missed it because I was late, can you work out for each individual how far they are away from the retail outlet, and rather just doing an ecologic analysis, code each individual up on how far they are away and look to see if that explains it using a multi-level analysis? The second thing that occurs to me is actually moving to a sort of multi-level study design, because you've got an ecologic exposure with individual level data you could adjust for it. And the third and last thing is the econometricians love this sort of stuff, and they're very good at types of analysis on this with difference and natural experiments. Have you liaised with those types of people? Because this is really important data and research questions you're addressing here. Congratulations.
Thanks. That's really that's a lot of questions, but I'll try my best. Tony, I reckon that is a really good suggestion. So one of Amanda Neal, one of my supervisors, is a health economist, and we were limited. So this is telling, and maybe it's a learning that everyone else needs to hear as researchers. The Roy Morgan data is not attached to individual postcode. It only goes to region, and when they do socioeconomic status particularly, they don't give us a location. So we have the location of the retailers, but not the location of the people. They give us, so that's a mismatch, and it's a limitation of the way that Roy Morgan releases their data individually. All we know is that they live in Tasmania, which is like huge, and that they either live north, south, southern, and that's it. So that's a limitation of the Roy Morgan data, which probably another study design starting with their own survey data would be able to capture. I do think that we need some local cohort studies around individuals, particularly the experience of people in regional Northern Territory, Aboriginal communities. We need that in our regional areas. We have an island where there's mutton bird fishing, mutton bird catching season every year, and we have 4 retailers selling tobacco, and there's whole communities that go onto that island, and gosh, it's really available. So I think that the story at a local level, you're right, multi-level needs to address that sub-Tasmanian population. I definitely think that the way that you're describing it is the next steps. I don't know if the data that we have is going to support those studies at this point. And the difference in differencing is actually what the joint point analysis does implicitly. I think that's what you're saying, isn't it? That the difference between the points.
Now it would be more difference between individuals, but I'm hearing that you don't have that data yet. But look, congrats for doing this stuff and keep going.
Thanks. I don't know if I answered all 3 of your questions.
No,
but,
no, it's just it's a tricky area, and just all power to you. Keep going.
Thank you.
I was on mute. I've got another question if we've got time for just a quick one. With the volume of sales that are reported, that's through a license condition, right? Do the retailers just report like the volumes per month or something like that? Or do they also report brands that are sold?
Yeah, great question. So we've had from 2021 to 2025 brand level reporting to the month of June for every retail outlet, not wholesale, just retail. In Northern Territory, they do by brand in the regional, they do it by region because they only do wholesale level.
Okay.
We've actually just amended our licensing condition to remove the brand. What we found was that the brand was supposed to show us a change in socioeconomic, like people attached to brands, and often the cheaper brands, the middle brands, the more expensive brands, we may see a shift in people and what they're smoking. Unfortunately, we didn't have the capability to be dealing with that level of detail. And so what we found with the standardized packaging of the 20 and the 20 cigarettes and the 30 roll your own, that we've actually just asked for volume of cigarettes, roll your own, and other products. And that's it's a repeated cross section essentially, because it's the June of every year. And really what we're finding more of, which we're hoping to estimate the smoking consumption and changes by individual level, but what we're really seeing now is which retailers are being affected most by illicit tobacco. Because what you can see is that their average amount of sales is being like dropped in certain areas, and then you follow up and you say your analysis is showing you selling a whole lot less. Is there something wrong with our system? Is a different person doing that study? And then they come out with, and that's why I think we're being affected. There's someone down the road that's selling, and I think that's why licensing schemes with really good relationships with the retailers is really important, because it's not red tape when it starts to help them, which is us identifying and taking action against someone that's taking from their sales.
Yeah, like one of the issues has been also determining which brands are legally sold in Australia. So, there's no like list of products that have been had their excise paid and so on. So, I don't know what the solution is to that at a state level, but whether that's also something where if you had brand data, at least you could see what sort of brands are being sold through those licensed premises. But it sounds like that's not continuing in Tasmania.
No. In fact, we have that data. It's probably something you could look at, but I do think that the standardization of the pack sizes is going to change the market, but I'm not sure how.
Okay. Okay, well, that's all the questions I have, and we're coming up to the hour. It looks like we don't have further questions. So I might close off the webinar, and thank you again for such an interesting talk, and well done for completing all of that research while you're also working.
Thank you. Thank you so much for the time and everyone coming along. It's been a real delight. Thank you.
Okay, thanks then.
Bye.